Hello, this is Judd. I'm one of the nephrology fellows at UAB here at NKF presenting a poster on chest x-rays and the diagnosis of pneumonia. What we did is we had looked at 122 patients all in the calendar year of 2010. They were admitted through the emergency department at UAB in Birmingham and tried to determine if they had pneumonia, pulmonary edema, both or neither, based on admission chest x-ray. And essentially, after excluding a certain number of patients, due to missing dialysis data or lack of initial chest x-ray, we finally got to the number of 68 patients that were analyzed. And of those 68 patients, we had 2 radiologists independently read their admission chest x-ray, and we asked them if they had pneumonia, pulmonary edema, both or neither. And then we just assessed their reliability in terms of how well they agreed, and we performed that by a statistical method called a kappa test. In addition to that, we were able to extract data from the patient's charts for these 68 patients, and the clinical data was analyzed in the entire hospital record by 2 independent clinicians. Those clinicians also determined the diagnosis for pneumonia or pulmonary edema, and essentially diagnosed each one of the 68 patients with either pneumonia or pulmonary edema. And the results, if the 2 clinicians disagreed, we adjudicated those results to have a clinical adjudicated diagnosis of pneumonia or pulmonary edema for each patient. And with that result, we were able to determine chest x-ray attributes and give us an idea of how good and how accurate and reliable a chest x-ray is in the diagnosis of pneumonia. So just to look on the agreement of the 2 radiologists, overall they had 40 out of 68% of the time that they agreed on pneumonia, which had a kappa statistics of 0.165, which a kappa coefficient of 0.165 is fairly low. It's around slight, so the agreement wasn't high. And that was similar for pulmonary edema as well. The clinicians had similar agreements, around 60% and 76%, however, was better for pulmonary edema. And the agreement overall from the radiologist did not depend on if the chest x-ray was a portable or a PA and lateral. The attributes for the chest radiograph show a sensitivity of around 50% for the diagnosis of pneumonia and a specificity of about 57%. The negative predictive value is 81%. And positive predictive value 24%. In addition to those results, we also did a multivariate logistic regression analysis, which wasn't included on this poster, which showed that there's really, in hemodialysis patients, no clinical feature that correlates well with the diagnosis of pneumonia. However, in pulmonary edema, the presence of a pleural effusion or a high admission diastolic blood pressure does correlate with pulmonary edema. Overall, the conclusion is that chest x-ray is, even though we heavily rely upon it for the diagnosis of pneumonia as clinicians, in the hemodialysis patient population, it is not a reliable or accurate tool to diagnose pneumonia, and the diagnosis of pneumonia in general remains a difficult diagnosis to make clinically. Perhaps in this patient population, the diagnosis of pneumonia is overdiagnosed, and the implications of that is that antibiotic use might be, I guess these patients might have more antibiotic exposure.